One of the most critical parts of patient care is fall prevention. Understanding the importance of assessing the patient prior to ambulating may be the key to catching an unforeseen fall, especially during the times when your patients will need to use the bathroom. In this video, we will demonstrate the proper techniques for using the gait belt, bed alarm, and a walker in conjunction with effective communication strategies as tools for falls prevention. Ensure that the path is clear of obstacles and hazards before beginning to assist your patient out of bed. When possible, disconnect unneeded lines and leads and fully remove sequential compression devices from legs to avoid tripping hazards. If lines and leads cannot be removed, ensure that they are unplugged from the wall and in a mode for safe mobility. Prior to having the patient exit the bed, ensure that the bed alarm is deactivated. Once the patient re-enters the bed alarm must be reactivated. Always have your patient put on non-skid socks so that they do not slip on the floor. When putting a gait belt on your patient, ensure that the teeth side of the buckle is facing out. Then, feed the end of the belt through the buckle, ensuring that the teeth grip the belt. Make sure the gait belt is snug, with 2 fingers worth of space between the belt and the patient. Tuck any extra length to avoid tripping hazards. Once you have the gait belt secured on your patient, ask them if they feel dizzy or lightheaded before assisting them with standing. Occasionally, the gait belt will loosen up a bit when the patient stands. Be sure to check that it's still snug. Walter Reed utilizes a battle buddy system for patients that are high risk for falling. Be sure to stay within arm's reach to assist if needed. A walker is an assistive device that is utilized for ambulation assistance when a patient is unsteady after a procedure, medication, or diagnosis that changes their mobility status. It is up to the provider to assess the need for an assistive device. To adjust the walker, press the tabs in at the bottom of each leg and adjust the leg up or down as needed. Ensure that all 4 legs are at equal height. When using a walker, instruct your patient not to pull on the walker to stand up. They should push up from the bed instead, then hold on to the walker once they're fully standing up. The height of the walker handles should line up with the wrist crease of the patient when they are standing with arms relaxed at their side. This will ensure that there's a slight bend of 20 to 30 degrees at the patient's elbow to give the optimal support while walking and standing. When assisting a patient in the bathroom, ensure that the patient holds onto the device throughout all movements. Have the patient turn and back up to the toilet, using grab bars as needed to slowly lower down onto the commode and to assist to stand. Do not let your patient pull at the walker, as this may result in tipping of the walker and an increased risk that the patient may fall. The walker may be used for support while a patient is in a standing position. When assisting a patient to the sink, ensure that the patient holds on to the walker at all times. The patient may do this by walking straight up to the sink with the walker in front of them. Once the patient is at the sink, they may step forward into the middle of the walker to reach the sink and continue their hygiene. If you are using a bedside commode, adjust the legs up or down as needed, while also ensuring that all 4 legs are at an equal height. Now you should have a better understanding of the proper techniques when using a gait belt or a walker when assisting your patients. You should also remember to disconnect before and then reattach the bed alarm system after they return. And of course, the importance of assessing the patient prior to ambulating. This is how we mitigate an unforeseen fall. Remember, we are all safety officers.